My name is Stephen Howell, and I'm a professor of mechanical engineering at UC Davis and orthopedic surgeon. And I've been performing kinematically aligned total knee arthroplasty since January of 2006. And what I'd like to share with you is the early clinical outcome that I've observed with kinematically aligned total knee arthroplasty. In terms of conflict of interest, I'm a co-founder of OtisMed and a designer of kinematic alignment for total knee arthroplasty. I'm also a consultant for Stryker Orthopedics and a consultant and receive royalties from Biomet Sports Medicine for ACL-related products. In terms of an overview, we're going to discuss two topics. One, I'm going to share with you some evidence from large databases that too many of our patients in the UK, USA, and Canada with a mechanically aligned total knee arthroplasty are really not that satisfied. And then I'll share with you our own experience that kinematically aligned total knee arthroplasty enables the patient to have a more consistent and rapid recovery with high satisfaction that both the patient and the caregiver and surgeons and therapists are looking for. So let's look at the evidence that too many patients are not satisfied with their mechanically aligned total knee arthroplasty. The dissatisfaction with mechanically aligned total knee arthroplasty is too high in UK or England. And this is based off Baker's study in the JBJS in 2007 that looked at the role of pain and function in determining patient satisfaction after total knee arthroplasty. And in this study, 10,000 patients were sent a postal questionnaire 1 year after the mechanically aligned total knee. And what they found was that 20% had persistent pain, 17% had pain with walking, and 16% had pain with shopping. And only 9%, based on the Oxford score, reported no or hardly any problems with their knee. So therefore, there's quite a bit of room for improvement. Similar to the UK, the dissatisfaction rate with mechanically aligned total knee arthroplasty is also too high in the USA. This is Nobel's case series, which won the INSALL award published in Core in 2006, that showed that patient expectations affect the satisfaction with total knee arthroplasty. And they had 253 patients that completed a questionnaire 1 year after mechanically aligned total knee arthroplasty, and only 75% were either very satisfied or satisfied with their knee. And they found that the 25% dissatisfaction rate was due to a low activity level, residual pain, stiffness, and swelling, which we believe is related to kinematic malalignment of the components. And again, there's room for improvement. And the third piece of evidence from another country is that there's a high dissatisfaction rate with mechanically aligned total knee arthroplasty in Canada. And this is Bob Bourne's work published in 2009 in Core, where they assessed patient satisfaction after total knee arthroplasty, trying to determine who was satisfied and who was not. And they too mailed a questionnaire. It was the WOMAC score this time, and at 1 year they had 1,703 patients return their questionnaire out of 2,051 knee arthroplasties. And they too found that 1 in 5 patients were not satisfied, or 19%, with the total knee arthroplasty, again confirming that whether you're in Europe or you're in Canada or the US, there's room for improvement when the total knee is done with mechanical alignment. So to summarize why patients are not satisfied with a mechanically aligned total knee arthroplasty, well, there's the situation of stiffness where the knee doesn't move as well as they'd like. Sometimes it results in manipulation. We've seen this flexion instability, whether it's early or mid or late flexion, causing a loss of confidence in the use of the knee. There's the good-looking x-rays, but the feel-bad knee, or the looks-good, feel-bad situation. And then there's this wear and loosening, which can occur more late in the process and typically is not from a mechanical alignment problem, but it's an axial malalignment problem because the wear is not in the center of the component, but in the posterior edges. So now I'd like to share with you that in our experience now, about 1,500 knees since January of 2006, that kinematic alignment of the total knee arthroplasty enables a consistent and rapid rate of recovery with a high patient satisfaction, much more than what we used to see with our mechanically aligned knee. We assessed our patients using a method for quantifying patient expectations and early recovery after total knee arthroplasty and reported it in Orthopedics in 2009. And we did our data analysis with a handheld data collection instrument, which was simply a Palm Pilot, which was important because it eliminates the interviewer bias. So the patient is just making their own responses, and there's no chance for it to be biased from a surgeon's input. The patient fills out the customized questionnaires that we ask, the SF-12 physical and mental score, the Oxford score, the Knee Society score, the length of stay, and discharge disposition. And we studied 308 consecutive knees in 285 patients, so it's a relatively large series. So let's see what the patient's perception was in terms of how straight their leg was when we saw them back at the 4 to 6 week mark. And if we look at our possible outcomes just right, 2 bow-legged, 2 knock-kneed, you'll find that with kinematic alignment, the patient's perception is that 98% of the time their limb is aligned just correctly, and about 2% of the time they think it might be a little bit knock-kneed. So this is something you have to try to look for, but it's a relatively rare event, 2 out of 100 patients. To get an assessment of how well the patient's recovering, we asked them at 4 to 5 weeks, how is your operative knee compared to your preoperative knee? And by 4 to 5 weeks, 88% were better, 8% were the same, and only 4% were worse. So we found that the majority of the patients by 4 to 5 weeks were better than they were, even at this early stage, than they were before their total knee arthroplasty. Now, when we asked them to compare their operative knee at 4 to 5 weeks to what they perceived to be a normal knee, it was quite surprising findings. We found that 20% by 4 to 5 weeks thought their total knee arthroplasty knee was normal compared to a normal knee, and 74% were nearly normal. So that means 94% of the patients thought their knee were normal or nearly normal by 4 to 5 weeks, and only a few were abnormal and severely abnormal. So this was a very quick recovery, getting patients back to the activities that are important to them for daily living. Now, if we look at some of the return to activities at 4 to 5 weeks, this is a typical patient that will come back in at 4 to 5 weeks with a knee. They're already off the walker, they're off their cane, their knee still has a little swelling, it may be a little bruised, but they can actively flex and extend it quite well, and you can see that this knee is relatively quiet, and the alignment is good, and they've got good quad control, and they're back to their daily activities. And so we want to ask, how long did it take them to get off their walker and their cane, and how long did it take them to drive their car? And if we look, you can see that the percentage of subjects at 4 to 5 weeks that were off the walker, off the cane, and driving the car, 90% were off the walker. Only those that remain on the walker were those that were using it preoperatively just to walk. Off the cane was 80% at 4 to 5 weeks. And then those that drove the car before surgery, over half were already back driving their car by 4 weeks after the total knee arthroplasty. Now, if we look at the hospital stay, and of course the hospital stays, a lot of variables that take place there, but we're able to reduce the length of stay. When we asked the patient how many nights they spent in the hospital, and this was confirmed by analyzing the hospital database, we found that about 6% stayed 1 night, 86% stayed 2 nights, 7% stayed 3 nights, and a very short percentage stayed more than 4 nights. Now, although our average length of stay was just under 2 nights, and that's an important achievement, what's more important is, are these patients going to a nursing home or they're going home? And indeed, if you ask the patient and then confirmed with the hospital database whether they went directly home or to a rehab facility, you'll find that 98% of these patients went home rather than a rehab facility under the care of their family within the first 1 to 2 nights after their total knee replacement. So why are we seeing a more rapid recovery? There's certainly a lot of variables with change in rehab, anesthetic management, and so forth, but the bottom line is that there's less perioperative stress with kinematic alignment. We don't use an IM rod, so there's no fat emboli, no hypoxia. We don't do collateral ligament releases, so the joint's contained. It's a little less painful. This gives us less blood loss. We have fewer transfusions. We can do it under general anesthesia in 35-40 minutes, so we can get the patient up and walk them right away. We use a quad-sparing exposure, and we think this gives better early motion. And here's a video of 6 patients the day after their total knee arthroplasty, and you can see the range of motion and exercise capability that they have. These patients all had their surgery done under a general anesthetic, no spinal, no epidural, no blocks. They simply were treated with Toradol, 15 IVQ8, an oral narcotic, and this is the type of motion and extension and flexion that they can get. And there are some unpublished data that we've accumulated where we looked at the kinematically aligned total knee arthroplasty Oxford scores at various time intervals in 12 centers and compared them to the mechanically aligned total knee arthroplasties done in the New Zealand Registry. And if we look at the 6-month New Zealand scores, with the excellent being less than 41 and the maximum Oxford score is 48, that you can see 33% are excellent and 34% are good, for 67% in the excellent and good category. And if we look at the kinematically aligned knee, it's actually a bit higher at 84% with a higher percentage of excellent scores. And then at 1 year, it's 91%, and at 2 years, it's 96%, with 84% with scores less than 41. So this efficiency and improved outcome is something that has been seen in other centers around the United States as well. In terms of conclusions, kinematic alignment has had a lower prevalence of dissatisfaction than reports of mechanically aligned total knee arthroplasty according to our own personal case series as well as the results from these 12 centers. Kinematic alignment seems to improve the postoperative experience. It's an enabling procedure by aligning the knee such that the axes in the knee are aligned back to what the normal knee was, and allows a more consistent and rapid rate of recovery than what we've seen with mechanically aligned total knee arthroplasty. And patients and their caregivers really seek out methods of TKA that quickly get them back to life, and we think that this is a very good option to achieve this goal. And in our experience, the kinematically aligned total knee arthroplasty, while not perfect, I mean, we still do have patients whose knees don't do as well as we'd like, but it certainly has reduced the prevalence of patient dissatisfaction that we used to see with mechanically aligned total knee arthroplasty. And if you want some additional information, please feel free to go to my website. We have some surgical techniques, journal articles, and presentations.